You're live.
Hello, everybody. I am Dr. Ray Victory, double board certified reproductive endocrinology fertility specialist with my dear friend Tarek Ibrahim, who is still trying to figure out your camera's on. It's on. And we are just getting everything set because we have a late dinner. So we're getting the show ready to roll. This is Fertility Fact or Fiction. I am your host, and Tarek is our co-host and guy for all things social media, and he is getting it all organized for us at the moment. Don't forget to turn on TikTok when you get a chance. I tried to prep a topic for tonight, but couldn't find a paper that I wanted. So we're going to just take more questions. Nothing super exciting in the fertility world, although a paper we just created a post on, which looks at whether or not high dose stim protocols damage your mitochondrial DNA. And a lot of people are on like super doses of medications, and their doctors tell them they need it to get enough eggs. And the reality is you don't. In fact, many times getting those high doses is useless. And there's already randomized controlled trial data that shows that there's no difference once you go over 300 units total per day. You're not getting any benefit above that. So we sometimes go up to 375, but I try very hard not to go above that. In general, we desperately avoid it. And there's new data that suggests that that's a good thing and that it should be avoided because it can actually damage the mitochondrial DNA and cause mutations, which are then very harmful. In fact, this particular study showed that the best embryos were the ones with the least amount of mitochondrial DNA damage or mutations. So very exciting and interesting stuff. And we are going to prepare a presentation on that. I haven't read through the full article yet, but that might be a good one to present next week. So we'll go over all of that stuff shortly. In the interim, for those of you that have questions, we are happy to take your questions. And we love challenges. So if you can stump me, we should probably develop some sort of prize for people that stump me. We got to give out merch. We need like mugs, and we send them to people that surprise us somehow. Are you having a minor heart attack?
Surprising. Yeah, minor heart attack, survived.
Are we good?
Yeah, we're good.
Instagram's up and running now?
It
was a beautiful thing.
It's a beautiful thing. When everything works, it's just great. Last minute panic is always...
It's always good.
It's always good.
Pressure under fire.
That's how I live, man.
Yeah.
Pressure under fire.
Yeah, I just call that marriage. By the way, I have to thank Tarek and his lovely wife, Mervet, who took us out to see Nima Naz, a Canadian Persian comedian who came to Windsor, and it was quite funny. And I enjoyed that very much. Brought back memories of being a kid in a Persian household. So for those of you who are Persian and watch the show, you should follow Nima Naz. It was very, very funny, and I had a good laugh. Anyways, fire away. Do we have questions already?
I had a great laugh for what it was worth.
It was very, very funny. Yeah.
We should actually mention him in a post, do a post for him.
We probably should. We should get him on the show. He probably
get him on the show.
What was interesting was the fact that because there were the three comedians, and all three comedians, everything was about race.
Yeah, that was the whole pitch. The whole joke was race.
There was nothing that was non-race.
I guess racism's funny.
Well, racism definitely not funny, but it was interesting that they were talking about different cultures, and they weren't necessarily mean about them, but it was interesting that everything had like a racial skew to it, right? I was kind of surprised about that. Like, can we not make jokes without having to allude to race? But
that was the bit. If it's not racist, if it's not accents, I think they're out of material.
I don't know. And the one guy was like apologizing for it. You remember?
Every joke he would apologize. Oh, by the way, I'm just joking. He was seesawing the whole time.
That part was a bit weird, but overall it was good. And the parts where he was talking about growing up in a Persian household were quite funny.
Hitting home?
Totally hitting home. Yeah. Yeah. It's funny that I'm a gynecologist considering my birds and the bees talk with my dad was me driving up the driveway. And my dad said, if you do anything wrong, I will take you out back and shoot you dead. That's the full extent of
That's
the
all
talk.
you need. You don't need more than that.
It worked. It was very good. Very effective talk. Thanks, Dad.
There's just too much effort in these things. Just be, straightforward. 2 minutes, done.
You got teen daughters. Have you had the talk, or has your wife had the talk?
I don't think I'll ever have the talk. I can't imagine what that talk is. Like, I understand people have talks. I get it.
You can't do it.
No, it's like, well, yeah, I'm not saying anything.
Oh, that's hilarious. I would love to hear from other people what you think what's the appropriate age to have the talk, the birds and the bees talk. I would love to see what people say about that. Because right now, what are they teaching in grade? Like
my son, he's in grade 4. I think he's in grade 4. Grade 4, and they had
sex ed
for
grade 4,
and I yanked him out. I'm like, you don't need to learn any of this.
How old is he?
9, single digits. I feel it's quite premature, to be quite honest.
I mean, what's a 9-year-old gonna do with sex ed? I don't get that.
I kept him home. I'm like, bro, stay at home today. Come with your dad. Learn how to work. Mind you, the work was a little bit daunting for him, but he tried. He tried to do stuff. Fold this, do this, write this. Answer this call, do this. That's real life lessons.
That's life lessons.
That's life.
That's
lessons.
Real life education.
That's right. This sex ed for grade 4. This is a joke.
Yeah, I don't know. I don't think sex ed at grade 4 makes a tremendous amount of sense to me either. But hey,
all you'll get at that age is just kids giggling. Look, he's got a pee-pee. You know what I mean? That'll be the whole thing. That's the maximum you get out of that age.
Yeah, I don't know. That does make sense to me.
Hey, Dr. V and Dr. T.
Yeah.
Can you comment on why so many NDs caution using resveratrol during pregnancy?
There's a concern that resveratrol may increase your bleeding risk. We don't see it, so I don't worry about it, but that's why they're worried about it. That was an easy one. That was a gimme.
It's a gimme.
Yeah.
Let's try to see something that's not a gimme. How long does it actually take to restore fertility after an IUD removal?
If you're talking about a levonorgestrel IUD, the standard sort of statement is that it takes about 3 months. That's the average. And that's what the literature showed when they first did the studies. With the copper IUD, it tends to be a little bit quicker because there's less of a hormonal impact, but it still can take a month or two, even with the copper IUD. Now, that doesn't mean you should count on that. So if you're planning a conception and you need it to be delayed, do not count on the fact that it'll be 3 months. That's an average. So some people were raring to go right away. Other people needed months and months and months. So you got to kind of know what to expect from all that.
Carly says that my mom made me watch Oprah's special on birds and the bees. Oprah taught me everything.
Carly, when am I coming on your show? We talked about it and we never did. We got to get Carly on our show too.
We should just get her on.
We should just get her
Absolutely.
on. Yeah.
Absolutely.
Carly, you got to come on. Talk to Tarek and he will plan it because we're doing the podcast. So
it'll be fun.
Carly's right. I love Carly.
Hi, TNV. Thoughts on PRP for euploid RIF? Thank you for all that you do.
Yeah. So research shows that there is a 50% improvement in live birth rates from doing uterine PRP in patients with recurrent RIF. Now, should you have testing and investigations first? Yes, because it might be microbiome, which PRP probably won't fix. It might be something else, immunological, which PRP may or may not fix. So I think it depends on what's going on, but definitely worth considering after you've had appropriate tests and investigation. So I support it entirely, but make sure that you have done the appropriate testing first before you dive into it.
Going to YouTube, the wonderful world of YouTube.
You know, we're almost at 30,000 followers.
I'm aware.
What's that?
I'm aware.
200 more, I think, and we're there.
We're right there on the cusp of victory.
No.
See that? See what I did there?
I got that.
Yeah,
that was cute.
Hey, Dr. V and Dr. D, I had my 6-week post-op after isthmus seal repair, and it showed my RMT went from 3 millimeters to 13. no fluid in lining. Would that be considered successful? Should I do a microbiome test?
No, that would be considered successful, but it doesn't eliminate the chances of microbiome abnormalities. So it is still really good. So that's great. I'm glad that you've got that. But I just did one today, actually, but it doesn't mean necessarily that you've corrected the microbiome. So it's still worth doing a microbiome test if it was messed up before. If you have enough embryos, it might be worth just trying. Great job, though. Whoever did that did a good job.
Hello, doctors.
Especially if it was me.
Plural on doctors.
On doctors, yeah.
Just in case.
Like that.
I take that.
Yeah.
How soon after an ovarian PRP can you try naturally?
You can try it immediately. Naturally, the same cycle you could try. There's no reason why you can't try it. There's no harm in that.
Hi, Dr. V and T. I had my 6 week. Oh, no, said that. Hey, Dr. V. What is the best immune protocol for a patient with endometriosis and high NK cells? My doctor wants me on 5 milligrams of prednisone. Is it enough?
So we use intralipids, prednisone, and tacrolimus. And that's based on the best evidence available for endometriosis treatment. 5 milligrams of prednisone is literally nothing. It's not even worth taking. We use 25 milligrams. I don't think you're going to see any kind of effect below that threshold dose. You might see something at 10, at 5. I can't imagine you're getting any impact. It's just way too low a dose. So I don't support that, but every doctor is different. Talk to your doctor, see why they wanted you to use such a low dose.
From our good old friends at TikTok, you mentioned the connection between melanoma and IVF. What are the studies on it?
There are actually very old studies looking at, and I think it was just one, looking at cancer risks and IVF, and one of them was melanoma. I'd have to go dig it up. I haven't looked at that for a very long time, but I do have it. Currently, my phone is being used for TikTok, so I can't look anything up while we're doing the show. I got me in a Toshiba mug of tea, but I can look it up. Send me a DM and I'll find the study for you.
3 follicles, 40 years old. Should I proceed?
I had this talk with several people the last couple of days, actually. I mean, it's so hard, right? Like, if you're kind of damned if you do, damned if you don't. If you don't do it, you'll never know, and you may or may not regret it. If you do it, you got to go into it fully armed with the knowledge that you have way less than the requisite number of follicles to make this work, and therefore it may not work, and you may be not wasting your money, but risking your money. So if you are comfortable with that risk, by all means, go for it. There's no reason not to. If you are not comfortable with that risk, don't do it. Yeah, because it's expensive and you may not succeed, and now you've got a problem.
Again, from TikTok. Hi, doctors. If first FET after suppression fails, do you have to get a period before another transfer?
Yes, you would have to get a period before another transfer, but you should, because you've probably taken some degree of estrogen or naturally produced some degree of estrogen, and then you took progesterone and you stopped it. So you should get a period. If you don't get a period, there's definitely something wrong.
Hey, doctors. After 3 months of letrozole Lupron suppression, when to expect a normal cycle again?
Somewhere between a month to 6 weeks later.
Hey, Dr. V. It's 8 days since my cervical dilation. Is it normal to still be bleeding? When can I resume normal activity, intercourse, baths, menstrual cups? You're the best.
Anytime, it'd be fine. Yeah. And yes, it's normal to still be bleeding a little bit.
You're flying through these questions just soon.
I know.
You're
we're
like
just
flying through them.
Wouldn't it be awesome if just once we got them all and we finished early?
Oh, that'd be a wild day.
I think it's been like 5 years since that.
Oh, yeah,
happened.
it's been like never.
It's
been
been
like, oh,
forever.
we're done. That's long gone. Those days are gone.
Yeah.
How long? Oh, we did that. Oh yeah, here we go. Hi, Dr. V. Hi, T and V. Okay. That's fine.
You got to put the camera on you, dude. It's on me right now.
Yeah. I didn't know how to react to that T and V thing. I'm just like, we'll take it. Thoughts on PRP for euploid RAF? Thank
No,
you
we
for all
did
you
that
did. Okay, so hey, Dr. V, my husband just got his initial blood work.
Okay.
Okay. Results back, and the clinic called him to let him know that he has unusually high thyroids.
Okay.
Could this be the cause for infertility?
Yeah, certainly even in a male, if your thyroid is dysfunctional, it's entirely possible that it's messing with your sperm production. So if you are severely hypothyroid as a male, it will impact your sperm production. So yes, that could be a potential cause for sure. And there's very reasonable data on that, not to mention an intimate endocrinological connection. So we always correct our guys. That's why we test our guys, because we do find some that are hypothyroid. I've never found a hyperthyroid male, but we found several that are hypothyroid and we correct them. Having said that, we don't hold them to the same TSH of 2.5 that we do for women because it's not necessary in men as far as we know. Although that'd probably be an interesting study to do as well.
Go Dr. V. Do you know why they said go Dr. V? What was the context of a go Dr. V?
I don't know.
Like, go Dr. V. Go Dr. V. Go Dr. V.
Maybe it's one of my kids.
No.
Oh, super cool.
Here we go.
So last week, Wednesday, my daughter Jenna came into the operating room with me for the first time ever.
Super cool for sure.
Yeah, it was like probably one of the proudest moments of my life. It was very, very cool. And she's just like this the whole time.
She could handle it?
Totally. She said, Dad, what if I pass out? I said, well, I'm just going to kick you out of the way, honey, because I got work to do.
We got to keep going.
So you better man up and be ready for it. But she was great. She watched all the procedures. She asked all sorts of questions. I grilled the poor little thing. I asked her every question I ask medical students. So she took a beating, but she was good and she loved it. She watched a cystectomy, multiple endometriosis cases and biopsies. And we finished it. And she said, Dad. And I said, yes. She said, I could have done that.
There you go. That's how you know. That's the sign.
So very, very cool. It was very nice. She's not allowed to do anything, but she could watch.
Of course, like me.
Yeah. a little different from me.
A smidget of a difference.
A smidgen of a difference, yeah.
Hey, Dr. V and Dr. T. See? Right, followed by Dr. T. See?
There you go.
They know. My husband has a varicocele.
Okay.
What are the chances of conceiving naturally, and what are the odds after correction?
So I can't answer that without knowing all sorts of details, namely his sperm performance. So just because he has a varicocele does not mean he cannot conceive. Many guys with varicoceles conceive perfectly fine. So there's a lot of detail that needs to go into that answer. I cannot tell you just based on what are his odds, but we do know that men with moderate and severe varicoceles can actually do much better in their sperm performance once they're corrected. Even small ones, you'll see a blip in improvement with correction. That's what the studies show. So we are believers in that, and we refer those patients to urology. Now, the problem I find is that urologists more and more are doing less surgical varicocelectomies where they used to tie off the veins, and they're sending the patients for embolization. And if you've ever seen a testicle after it's been embolized, it's got plastic particles in it, like literally polyvinyl alcohol particles in it. So I don't love that. Like, they look weird, and you can see all these particles that are not just in the vein, they're actually in the testicle. I can't imagine that having plastic in your testicles is a smart idea. So stitch, sure, right? You tie it off, it dissolves, it's gone. There's no long lasting impact, but PVA, I don't know. It doesn't make sense to me. So I'm kind of opposed to that approach to things, but not based on any evidence. And I freely admit that, but I don't like the fact that the particles travel. Good example being women who were less than 35 were basically told they should not get uterine artery embolizations when we started doing those for fibroids, because a higher percentage of them became menopausal because some of the particles would travel through the blood vessels and go plug off the uterine blood supply. And so because of that, I was like, oh, this doesn't make sense in guys either. So I'm quite hesitant on doing it that way. But I do believe that varicoceles should be treated, and they should be treated by a urologist. But I'm a huge fan of doing them surgically by the urologist rather than radiographically by an interventional radiologist. Like, would you let someone inject plastic into your nuts?
Ain't nothing plastic going around me. I'm against plastic
Altogether?
and all that stuff.
Yeah, I'm not a believer either.
But right in, eh?
So they inject it into the vein and they're supposed to create a plug. But I mean, as it's plugging, some of those particles, they
get loose.
Yeah, they get loose. They drift and they go into the testicular tissue and they don't come out.
They don't come out.
So when you ultrasound them, it looks like little starry night in the testicle. There's all these little specks that show. I don't want that.
I'm not into starry night in my nuts.
I'm not into starry night in my nuts.
No. Somebody else can have that fun. I'm good.
Yeah. I don't mind seeing stars, but
stars are nice. I enjoy stars.
Yeah.
Absolutely. Stars are beautiful.
I don't want a starry night in my nuts either.
Time and place for the stars.
I don't think that's what Van Gogh had in mind exactly.
He did not. He did not. I can assure you.
Yeah.
It was not a testicle in his mind.
Yeah.
Hey, Dr. V and Mr. T, how much can HPV and high-grade dysplasia affect fertility? And is it possible to have had a false positive because I disrupted vaginal flora due to antibiotics?
There are a couple of studies that have shown associations with infertility and HPV, but the overwhelming majority of data does not show a significant impact of HPV infection on fertility. Now, it certainly has a huge impact on your cervical cancer, vaginal cancer, vulvar cancer rates, and it's very important to follow. And please make sure you get your pap smears and now HPV tests. But it doesn't look like it has a huge impact on fertility. From the standpoint of could it be a false positive? Probably not, because it's a PCR-based HPV DNA test. So those tests are not going to show up false positive because of treatment or antibiotics. You'd have to have some other virus that acted very similar to HPV and got misread as HPV by the test by accident. And the test doesn't really do that. So it's very, very unlikely that that would happen.
Hi, Dr. V. I have KIRAA genotype.
Okay.
Would LIT help? I struggle with secondary infertility,
No.
diagnosed with endo, high NK cells, and a history of endometriosis that was cleared.
Not usually. For KIR mismatches, we use Neupogen. Dr. V from Veneriatis from Fertility recommends Neupogen. I recommend Neupogen. I don't know if Fred's watching the show, but Fred, feel free to chime in if you're around. I don't believe that there's any benefit to LIT. So we don't use it for that purpose. No.
Good evening, Dr. V.
Hello.
I'm 8 weeks pregnant with RPL history.
Okay.
Could prednisone 25 be causing my liver enzymes, especially, or ESP ALT?
Especially ALT. Yeah.
Especially ALT to be elevated. And what could I do about it? Thanks.
Not usually. I've certainly never heard of that happening before. I would be wanting to look at other meds that you were on. I've never heard of steroids increasing your ALT. So I'd be looking for viral infections. I'd be looking for meds you're on, gallbladder disease, all sorts of different problems. Get an ultrasound, but it's unlikely. It's that there are supplements that can raise your ALT levels. So check your supplement level.
From YouTube, any supplements to avoid after ovarian PRP? Example, is it okay to take resveratrol, curcumin, vitamin E, and omega again?
There is zero evidence to answer that question. So I'm going to go ahead and say that no one knows, but I can't think of a medical reason why you wouldn't be eligible to go back on your supplements, but there's no evidence. There's no studies that have looked at that at all.
Great question coming up for you.
Okay.
Ready? Just making sure, you know.
Hit me with your best shot. Do you want me to sing the little Pat Benatar song?
No, it's good. It's good. It's good. It's good. It's good. Hi, Dr. T. That's how it starts. And Dr. V. So you eventually become addressed.
Okay, yeah.
So don't worry too
thanks
much.
for acknowledging me.
Of course.
Yeah.
I'll be coming to VRC.
Excellent.
Hooray, they say.
Okay.
Hooray. What can I expect at my first visit, and how can I prepare to get the most out of my appointment?
So we do a detailed history. We learn everything about you that we can. We go through everything about you and your partner. We explain infertility in great detail. We'll go through the processes we go through, depending on what's wrong, to get you to where you need to be. We go through what kind of tests we perform, why we perform them. And then we talk to you about what your goals are, what your hopes are, what your desires are in terms of, do you want a more natural approach? Do you want a more, artificial approach? Do you want 3 kids? Do you want 10 kids? Do you only want 1 baby? Are there genetic issues? That kind of thing. We figure it all out, and then we go from there. Importantly, we also will review things you've done in the past. So if you've been with another center, which is a lot of our patients, because we're now the go-to for people that have failed in other places, then we talk to you about that as well. So there's a lot that we do during those appointments. And we figure out what's happened, what you've been told. I try my best to maintain a poker face, but I do admit I'm terrible at poker face. So when people have had bad care somewhere else, I'm just shaking my head the whole time. I had a couple today where she had pretty aggressive endometriosis, not horrible, but kind of stage 1, stage 2 from the operative report that I was reading. And her fertility specialist had told her that endo doesn't matter when you're doing IVF. I was just like, that's the classic endo line. Like, how can people say that? We know endo matters. So, I don't have a good poker face for that one. I don't even have it on the show, let alone when I'm talking to people in person.
How long after an ovarian PRP should ASA be held?
Oh, probably just a couple of days, nothing major.
Hi, Dr. V. Just suffered another MC from a large SCH.
Oh, I'm sorry.
Only immune testing finding was low NK cell activity. Any idea why this keeps happening? I've heard there can be an immune component. Also, IVF doctor wants me to try dilation meds before a DNC, but OB says to do just the DNC. Which way would you recommend if my body doesn't pass it on its own?
Meds like misoprostol prior to a DNC increase the safety by reducing the chances of difficulty at dilation, which also includes perforation of your uterus, which is risky. So there's no harm in doing that. The downside is that you may get really crampy and you may start passing tissue, which is obviously not ideal. So we don't love that. But there's no question that it can be sort of safer to do the misoprostol. As to why you're experiencing subchorionic hemorrhage, I would need to know lots about you. We check your immune system. We check your microbiome. We would look at the shape of your uterus very carefully. We would look at whether or not you have a thrombophilia. We would look at your partner's sperm DNA fragmentation. Tarek and I, just before dinner or during dinner, looked at a guy online, some doctor, a holistic doctor. I love it. As soon as you say holistic, 10 million people come out of the woodwork, right? So he has 517,000 followers. And once again, repeated the incorrect statement that guys are the main cause of miscarriage. Guys are not the main cause of miscarriage. Genetic abnormality in your embryos are the main cause of miscarriage, which is not mainly caused by guys. It's actually mainly caused by oocyte quality. So, and meiotic errors in division. So, I don't know why they keep saying that, but somebody's just feeding these people the wrong information.
Well, it's because it's just so good to blame the guys. It's great for like, it just, true and false doesn't matter sometimes.
Sensationalism.
Sensationalism.
Yeah. The more radical the thing you say online now, the more people believe it and they go for it.
Absolutely.
Like, it's just crazy.
Absolutely.
I could come out and just make up the most nonsensical BS, and people will go, "Oh yeah, like that's totally true." That
It
that
happened to me. That's what they'll say. It happened to me.
So here's a great story. So Peter McCullough, who's an avowed anti-vax guy who claims he's like this genius, right? He's constantly misrepresenting stuff, and he does it very convincingly. I got to give the guy credit. He should get an Academy Award for acting, because it's all total nonsense what he's saying, but he presents it like it's ironclad, hardcore scientific facts. So the most recent one was, they've now proven, this is what he says, they've now proven beyond a doubt that the COVID vaccine kills your fertility and reduces the number of eggs you have. And so I was like, whoa, like, when did they prove that? Because last time I checked, there was no such thing. So I go and I look at this study. Okay. So the study, and he's going on and on. We know now for sure it cuts the number of eggs by, like, I think he said 50%, and it's harming your fertility, blah, blah. So I looked at this study. So they took, I think it was like 17 rats, 17, not even a high number, a couple of rats, right? And they injected them with the human dose of COVID vaccine, which in size reference is 400,000 times the amount you need.
Oh, wow.
Okay.
Great.
So they give these rats 400,000 times the rat equivalent of the COVID vaccine dose. And then they take them after a month and they kill them. And then they cut their ovaries and look at them and determine how many eggs were there. And sure enough, after they took a blast of vaccine, right, they had some damage to the eggs. So then he's not talking about the fact that this is a rat study. He's not talking about the fact that they didn't actually look at any fertility outcomes. They don't even know if these rats reproduced because they killed them before they had a chance. He goes, ironclad, it's definitive now. We know that it's killing your ovaries. Well, no, we don't know that at all. But they're so convincing because it's so unhinged and it's such nonsensical and it's so like sensational that everyone like jumps on board. Yeah, we knew it, you know, blah, blah. I'm like, it's a rat study. It's just total nonsense.
No, let's play devil's advocate for a moment. Let me be Mr. Let me be Mr. Anti-vaxxer for a moment, just for fun.
All right.
Let's see where this goes.
Okay.
So, can't we assume that rats and humans will have similar outcomes?
No, not even remotely close.
Is that right? Not even remotely close?
I mean, rats have tons of pups from one, birthing experience. We have one, maybe two, right?
Oh, I see.
Maximum.
Yeah, they have like a litter, right?
That's right. And the rat doesn't have our body fat distribution. It doesn't have our organ system.
Oh, so it's
not the same immune system. Like
nothing in common.
Well, there's commonalities, but not that.
Yeah, they got feet, they got hands, but it's not enough to go off of.
This would be okay. So let's say there was a vaccine for some elephant virus. Let's
call it the elephant virus.
So
what's going to happen? There's going to be a clip now. Dr. Victor said the elephant virus is coming to Canada. That's what's going to end up happening.
So Peter McCullough's comparison, this would be great for the social media. So Peter McCullough's comparison of the damage to ovaries done by a coronavirus in rats, not humans, where he completely misrepresents the data, claiming it's true in humans, is the equivalent of saying that if there was some sort of, elephant, or even bigger than that, what's bigger than an elephant? Like a whale virus, okay? Oh, yeah. Some sort of humpback whale virus, right? Like a bad, and we developed, for God knows what reason, a humpback whale vaccine against humpback whale virus. And we took that, and to test the impact of it on whales, we're going to inject it into people to see what the outcome is. I mean, I'm turning into a whale, but I'm currently not a whale.
I actually feel like I'm floating right now. Like I am so full.
So that's not a valid study. And if I presented that and I said, look, it killed human ovaries, obviously it's going to kill the whales. Well, is that obvious? Of course not, because we're not whales.
You know what we should do? We should invite Peter McCullough on the show.
Oh, I wouldn't be able to tolerate it.
We should just call him on the show.
I would need a vomit bucket.
No way.
And I don't
really.
oh, the guy's just mental. He just and every 2 seconds it'd be like, that's not true. That's this study. Let's look at it. He'd be like, no. The so and so. Remember that organization? What was that
I
organization?
remember that organization.
Okay, he references some global organization. I looked it up. Like their catch line is all pharma is evil, and no one should believe anything said scientifically. It's opinion that matters. I was like, what? Complete nonsense. It's unhinged.
Don't forget to like and share, everybody.
Don't forget to like and share, everybody. And please comment. We love feedback. Feedback's good for us.
What supplements should I be taking for trying to conceive over 40?
Coenzyme Q10, your prenatal vitamin, fish oils, melatonin. Those are the basics. Vitamin D, iron if you need iron. Those are the basic ones we recommend to everybody. Age, not really important, but those are the basic ones.
Dr. V. 3 exclamation marks after the V.
Oh, I love it.
This is serious.
Yeah.
I'm not mentioned anywhere in here. So
you're a little wounded.
They're lucky I'm asking the question as far as I'm concerned. Can you please give me an update on what's going on with Fertility? Do you know if they are taking shipments from the US?
So I reached out to Dr. Veneriatis from Fertility today. I have not heard back. I know in Canada, part of the problem is that DHL went on strike and they use DHL. So I don't know what's happening with Fertility at the moment. I found that out at 11 o'clock or 11:30 today. So currently Fertility is on hold till I hear back from them. I don't know what's going on. We're trying to find out.
Dr. Victory, how can I increase chances of an FETP to be successful for a 4AA euploid?
Make sure your diet's healthy, make sure you're exercising, keep your stress level low, have lots of sex the night before and after, as long as you're gentle. Take all your vitamins and supplements, make sure the shape of your uterus is normal. And then if you want to go like the extra mile, do advanced testing for microbiome and immunological things to make sure everything's perfect. That is the best you can do. Oh, I guess the protocol. Do not use a hormone replacement therapy protocol. Natural or letrozole is better. Make sure you're using dual progesterone, which is vaginal and injectable, and measure your progesterone levels. All of that stuff is really important. Try and avoid estrogen if you can.
6 days post IUI and had no signs, feeling hopeless. Second IUI, first one failed.
It is way too early at 6 days. We had a patient test the day after we did our embryo transfer.
Day after.
Like that, it's not going to show up yet. So yeah, don't do that. There's no value to doing that. That's completely unnecessary.
Plus, you're stressing yourself out too much.
You are, which reduces the chances likely. So
that's right. So stay calm, stay cool. Do yoga, acupuncture, as you say.
Acupuncture,
right?
Yeah.
Right. And have a good time.
Yeah.
Dr. T reporting for duty. Any updates on IVM, Dr. V?
Yes. The IRB protocol holder currently promised me today that he would have my response soon. I am going to hold him to that. And then once that's in, we got to send it to the guy that gave us the media. And then I'm hoping very, very much by the end of the month, we're ready to go. Hopefully. We also need some extra equipment. Fariba just told me today, but we'll do our best.
Hello, doctors.
You like that one?
Yeah, that's a good one. Could you speak? Sure, I can speak on it. No problem. About or maybe make an episode.
An episode? Wow.
Specifically about maternal death risk causes in childbirth. I'm 40 and pregnant and scared about AFE and other such risks.
Oh, wow. So your risk of getting an AFE is incredibly low. I think I've seen one in my entire career. It is not a common thing that we see. It's very uncommon, very low percentage. So I would not be worried about AFE.
Things you should be concerned about are gestational diabetes, preeclampsia. Those are higher in women that are older, depending on your body mass index and your activity level. DVT, pulmonary embolism, those are possibilities during pregnancy. And then things like preterm labor, if you're ruptured of membranes, you got to worry about infection. But all of that is controllable by a good OBGYN who is taking good care of you. I've been doing this a lot and for a very long time, and I have never, ever lost a mom in the history of my obstetrical practice. So I take really good care of my patients. All of my colleagues take really good care of our patients. We're a really good team here in Windsor. You, generally speaking, do not need to be worried. You're going to get excellent care throughout Canada. I can't say that of every doctor in every location, but I can tell you that in Canada, most physicians are very, very good, very competent. Our licensing is very stringent, and the regulatory bodies, watch over us very carefully. So I think you'll get great care, and I wouldn't worry too much about those fringe things like an amniotic fluid embolism. Like I probably delivered somewhere around 12,000 babies in my career, and I've only seen one, and that wasn't even in someone delivering a baby. It was actually in someone that had had a very late termination of her pregnancy.
Is PGT testing worth it?
Yes, in the right circumstances. So if you are older, it's worth it. If you are 35 and over, it may be worth it. If you are 35 and under, it probably is not worth it unless you have a specific reason to do PGT, like you've got cystic fibrosis, your partner's got cystic fibrosis carrier status, and you're trying to make sure the baby doesn't have it, or any other kind of genetic abnormality. So is it worth it every time? No. Are there specific groups where it's worth it? Yes. Recurrent pregnancy loss, recurrent implantation failures, worth it. There are many different things where we would look at and say, yes, PGT is indicated here, but it varies from patient to patient. And that's a really good area to have an in-depth discussion with your doctor and with geneticists, right? Like we have genomic care we work with, and they'll counsel our patients. So they can give you advice on whether or not they think it's appropriate for you or not.
Why is immune testing and treatment such as LIT is still not recommended by guidelines such as the CFSA or ESHRE?
CFAS. The data on it is coming around, but it's not fully there yet. So I'll give you a really good example. Ontario just late last week agreed to fund IVIG and subcutaneous IG for fertility patients under certain circumstances. So in order for the government to fork out that kind of money, it took decades for them to believe the research. It's hard to get doctors to change. Like we're not the easiest people to convince. I take a lot of convincing as well, but I am convinced by data and science. I'm less convinced by my kids and my wife, but I'm convinced by data and science. So, we believe in science, but not everybody believes when they read stuff. So I do think LIT will come around the corner because there's meta-analysis showing LIT is beneficial. But until you get that out to people, it takes a long, long time. They're just not believers until they see it work.
You ready for this one? This is a good one.
And there's a financial disincentive. I got to say that too, right? When we succeed on first try, it's not good for our bank accounts. So not everybody necessarily, and I'm not speaking about anybody specific, but not every clinic wants you to succeed on first try. Some people have a vested interest in you coming back for more cycles. So that's always been my argument for why fertility clinics should not be owned by business. They should be owned by doctors, because we have a moral obligation to provide you with good care and to optimize it for you every time. Businesses don't have a moral obligation to do that to you. They got a obligation to answer to their board or their stockholders or their investors or whoever it is. So the obligations are very, very, very different.
When is it time? You ready?
When's it time?
For ERRA and ALICE tests.
So the ERRA has been proven to be not only useless, but actually detrimental. If you look at the Kevin Richter reanalysis of the Doyle study in JAMA, he very carefully demonstrated that it's a 13% decrease in success rates if you follow the ERA. So no one ever, under any circumstances, should do an ERA. The test is not capable of detecting what it proposes it can detect. It cannot detect implantation or receptivity. It just can't. It's not designed to do it, and it doesn't work. So that test is useless. Emma Alice, I have a major problem with, because 20% of the time they claim that the uterus is sterile, meaning they find no bacteria there. In my opinion, that's impossible. And because I don't think that that's possible, I don't endorse their test. And I had this debate with them, and they said, no, we're the world experts. We know what we're talking about. I was like, no, you've got a faulty test. Like, it just doesn't work. So in my opinion, that test does not work. So I do not endorse Emma, Alice, and definitely not the ERA.
Hi, Dr. VNT. I got my third Lupron shot yesterday, and my E2 was 83 picomoles.
Yeah.
The week I got my third Lupron shot, and my E2 was 84 picomoles. The week prior, it was less than 40. Is this concerning?
No, that's still a really low estrogen level, so I'm not worried about that at all.
When is mini IVF a good idea? Can an egg donor who has multiple healthy pregnancies do mini IVF?
Mini IVF is a good idea when you're worried that the patient has a poor response to the stimulation meds and that we're harming or damaging their egg quality because of the medications. So in those circumstances, I do turn to mini IVF. It's also a good choice for people with religious objections to having multiple eggs, multiple frozen embryos, and so on. So there are some various indications for it. Those are the two off the top of my head, but there are many others, I'm sure. Would I use it on an egg donor? Absolutely never. I mean, in the presence of an egg donor, you want to get as many eggs as you can within reason so that you can have lots to make patients as many embryos as they want. Do you need to use them all and make all the embryos right from the get-go? No, because that's not necessarily in everybody's best moral or religious or philosophical interests or ethical. But do you want to have lots of eggs frozen or kept or used? Yeah, you do. You want to have lots so that if the patient decides they want 3 kids, you have enough to make them 3 kids. So I would encourage people to look at that.
Do you always do PGT testing?
No. There are some clinics that do. Some of my good friends, one in particular, says that he does it for 80% of his patients. I can't endorse that. We're about to open up our own PGT lab very, very soon. And do it all on site. And I'm still not going to push people who are less than 35 to do it because it just doesn't make sense. There's no data to support that. So why would I do that? So despite the fact that we're opening up the lab for it, I'm still not going to do it in those patients. We'll do it where it's indicated. You're frozen.
Dr. V, I was diagnosed with PCOS and endometriosis recently, but I only check one of the symptoms on each symptom list. Missed periods, and they found endocysts after IVF hormone treatment.
That's the question.
That is the question.
You know, this is a great question. And I had this discussion with somebody today, actually a patient. So the presence or absence of symptoms for endometriosis is irrelevant to the diagnosis. Remember, 44% of patients with unexplained infertility, where they have no symptoms, no findings, all their tests are negative, actually have endometriosis. So many patients with endo have no symptoms whatsoever. Naomi Whitaker, who is one of the fertility NAPRO surgeons, who's pretty popular on Instagram and I chat with all the time. She had a post recently talking about that. And I jumped on and I said, like, remember, you know, I was supporting what she said. And I said, remember 44%. She said in her experience, and Dr. Nazat, who's probably the greatest, you know, reproductive surgeon in the world, they said the two of them find that it's probably over 90%. I don't think it's that high, but it's high. It's very rare that I'll take someone to the OR to look at what's going on with unexplained infertility and not find endometriosis. I almost always do.
Dr. Venus, Dr. T?
Mr. Dr. T?
No, just Dr. T.
Oh,
I
just
thought it was
Dr. T.
Mr., but then I noticed it was Doctor, and I had to correct that right away.
All right.
My iron is 8 micrograms UG,
Yeah.
right?
Yeah.
Per liter, and have been told I'm iron deficient.
Yeah.
Will this impact an egg retrieval / the quality of my eggs? Thank you for all you do.
Yeah, it probably could. There are some studies that look at the relationship between iron levels and egg outcomes. So I would get your IV infusion and boost up your iron levels. That would be really important for you.
How long after a slight septum repair via hysteroscopy can you do a transfer?
Next month, as long as the septum's repaired, you'd be fine.
Hello, Doc. I am a Dr. Rahal patient at VRC.
Excellent. I love Dr. Rahal. Great.
And
doctor.
me and my partner had timed intercourse and it didn't go through. And what should be the next best option? IUI or again, one more timed intercourse?
Well, I think you need to talk to Dr. Rahal so she knows your whole history, but you have options. Timed intercourse just once is not enough. I mean, it would take multiple tries usually. So if you want to upgrade to IUI, great choice. If you want to just keep it neutral, you can do that too. It's totally up to you.
Don't you say they should try every single day when they're doing
every day or every other day for sex?
Yeah.
Yeah. But we do tell them like this is the target day when you do timed intercourse because we can trigger so we can even nail the time.
Gotcha.
Yeah.
Doctors, plural, you, me, all of us.
All of us. Yeah.
Even the guy over there. Doctors, can a RI protocol be successful trying naturally with time intercourse? I'm not ready for another frozen embryo transfer, but I want to try an RI protocol naturally.
I get this question all the time. So can it be, beneficial or productive or positive or whatever, as successful? Yes, of course it can. And is there any reason not to do it? Well, the only element that worries me is that it's often costly to do these protocols and you're getting a very low chance of success when you're trying naturally. So as long as you're okay with the financial implications of it, absolutely no reason not to try. But if you're not comfortable with the financial implications, because it's a, low yield for a high cost, that's where I get a little more anxious about telling patients try naturally. Because if you got to spend, I don't know, whatever, $500, $1,000, $2,000, people using IVIG, $5,000, $10,000 to achieve the pregnancy, and you have the option to get a 5% or an 80%. I mean, obviously it makes way more sense to go for the 80%, right? So it depends very, very much on what the target is and what your comfort level is and so on.
How is fertility done? Is it with menstrual blood?
Yes, it's done with menstrual blood, a vaginal swab for the microbiome. For the immune testing, it's, serum blood. So they take it from your arm.
Hi, docs. Again, I'm feeling good today. CD56, CD16, NK lymphocytes at 22%.
Woo.
Other blood work looks good. Any chance for semi-natural transfer without lupron suppression? Had endo CH4 excised 2.7 years ago. Now one new cyst, 2 SM.
Too small.
Too small. Yeah. Okay. Too small.
Any chance? Always a chance. Does it make sense to try? No. Definitely no. I would never try a non-suppressed, non-endo protocol on someone with stage 4. I shouldn't say never. I would never recommend that. I would always advocate for our endo protocol. Do you have to do that? No. If it's your choice and they're your embryos, so you do what you feel is best for you. But would I try that myself or for my family member? no, I wouldn't. I'd be doing an endo protocol for them for sure. Huge benefit. Having said that, keep in mind that Lupron alone is not appropriate suppression for an endo protocol, not even close.
How can I increase my chances of a FET to be successful for a 4AA
We did that
euploid? Thoughts on a unicornuate uterus? Have had rudimentary horn and a chemical pregnancy from my first FET. Any suggestions for my next transfer? My uterine lining gets between 6.5 to 7.5.
No, I mean, the lining in a unicornea, it's going to be thinner. It usually is. So that's okay. Just make sure they don't go into the rudimentary horn. That would be really important. And make sure they can see the uterus really well. If your uterus is flipped over backwards, you are going to need a transvaginal ultrasound guided transfer. Or at least I'd recommend that.
Hi, Dr. V and Mr. T. Nope. Let me read that again. This is important. Hi, Dr. V and Mr. Dr. T. Full title.
Yeah.
Looking at trying for baby number 2 after a C-section, what testing would need to be done before the embryo transfer?
Infectious disease screen, hormones, vitamins, saline infusions on a histogram. Those are the main ones.
Can we do GLP-1 for weight loss before transfer?
Yeah, you just have to stop 6 weeks in advance.
Dr. V, as you know, my husband was taking testosterone and you took him off and started him on HGC and Clomid.
Yeah.
It's a very personal story here.
Yeah.
What are the chances his sperm will correct themselves, low motility and abnormal shape after 2 months?
After 2 months, probably not very high, but after 2.5 to 3 months, quite good. It can take a while depending on how high a dose of testosterone he was on and how long he was on it for. It'll change the outcomes of the yield of that stuff. So we have some guys that respond very well and quickly. We have other guys that take 6 months, even up to a year to get a benefit from it. So guys that are on like anabolic steroids, like the bodybuilders, they take a long time to recover. A long time if they recover.
Fertility retest showed urea plasma infection that wasn't there in February 3. 3 more weeks of antibiotics times 2. Should this be enough to clear it? Lacto was not detected. Now very low. Daily flora enough?
No, you're going to need biofilm breakers. You're going to need high potency probiotics, vaginal and oral. You probably need to see a naturopath. There's a lot that goes into it. It's not just a simple thing.
From TikTok. I got my 3rd Lupron shot and my E2 was 84.
We did that one.
How can you diagnose? We did that too. Did an egg retrieval, PERG, in April.
Yeah.
1 embryo. Is there a benefit to doing rounds closer together?
Sometimes you get like a little bit of a priming effect of the ovary from the stimulation. So there can be a benefit to it. I don't always see it work, but sometimes we see a bit of a benefit where back-to-back cycles, you get a little bit of a boost in the number of eggs that are produced.
Any way I can get back my cycle to come back while still nursing a baby?
Nothing safe. No.
Modified natural transfer of a day 6 frozen embryo. How many days of progesterone before transfer?
We do 6 completed days. So we transfer on the morning of the 7th or afternoon of the 7th. 9 o'clock.
Medrol or prednisone?
We use Medrol for routine ones. We use prednisone for the non-routine ones, but I may switch to Dex. So,
how can you diagnose endometriosis?
Only via laparoscopy with biopsy.
Do you typically induce between 38 to 40 weeks for IVF pregnancy? Nervous to go to post dates?
No, I induce at 39 weeks, not between 38 and 40. In the 39th week.
Is there a correlation between baby aspirin and SCH?
Not that anyone's observed, but we all know it's got to be there.
You take patients' concerns seriously, and that is the only one of my favorite things about you.
I appreciate that. Time to sign off.
Yeah. Let's
9
do it.
o'clock.
We're not getting anywhere near the bottom of these lists.
No.
Let me just really quickly show you where I paused, just on TikTok, just for funsies. So I left off here.
Yeah. Oh my God. That's a lot of questions, folks. Thank you to all of you for watching. We appreciate you. Make sure you comment, like, share. We love that. Watch our Instagram posts. We appreciate that too. And the TikTok ones. Give us feedback on how we can improve. We are always open to that. And if you need help, we are the place to be. So let us know and we will be there for you. I hope you guys have a great week. And we will see you next week. We're back next week on Fertility Fact or Fiction. I am your host, Dr. Rahi Victory and Tarek.
Bye.